Tonight on Mississippi Insight, countdown to the 2021 session. One of the leading Democrats in the Capitol talks about the agenda. Also, COVID-19, how it will impact the session as it surges across the state. And Vicksburg Mayor takes a hard line on enforcing COVID-19 restrictions, putting businesses on notice. We ask him how those efforts are going and also his thoughts on whether he'll take a COVID-19 vaccine. The answer may surprise you.
Do I have to?
Hello and welcome to Mississippi Insight. I'm Byron Brown. Thank you for joining us. The 2021 session starts just after the new year, and tonight we are getting the Democratic perspective. Joining us live via Zoom is Chairman of the House Democratic Caucus, Representative Robert Johnson. First off, we are talking COVID-19 as it seems to impact many aspects of our lives. This week you had an emergency meeting on whether the 2021 session should be postponed. What came out of that meeting?
Well, before I met with the speaker, talked to the speaker, he and the lieutenant governor had some extended talks. I had talked to the speaker previously, and his position had been that we were ready to proceed pursuant to the statute, meet in January, and continue with our 90-day session. Apparently, there was some talk in the Senate about doing something else. At the end of the day, we decided to stick with our current schedule, come in January, first Tuesday, get to work, and proceed with protocols in place to protect everybody during this crisis. But there won't be a postponement.
How concerned are you for what happened last year in the last session with all the COVID cases? How concerned are you going into this session?
Well, I feel better now because everything we talked about prior to the last session, and I had the same kind of meetings with the speaker, and to his credit, he put protocols in place. The problem is he didn't enforce them. We came into the pandemic session after we had left and came back. We came in with the understanding that we would social distance and everybody would wear masks. But people didn't abide by that. People did not social distance. People were not compliant and wearing their mask. And as a result, people got sick. Now, when we come back this time, I've been assured by the speaker that those protocols will be in place. We will enforce social distancing. We will meet and, we'll quarantine people in separate rooms. Quarantine not because they're infected, but keep people separated where they could be, appropriately distanced and require everyone to wear a mask. And I think that will provide the requisite protection that we need to conduct business.
When you say enforcing, who's going to be enforcing that? Will it be the state lawmakers themselves, or will you work on these law enforcement to help with enforcement?
Well, it'll be the state lawmakers ourselves. We would just, and I say enforcement may be a strong word, but it would be strongly encouraged, and we may even, some people may be excluded from meetings if they don't comply with the mask. But I can tell you, before we left this summer, by the time we left and people were getting sick, just about everybody in the Capitol that we didn't have people walking around saying, I'm not going to wear a mask. Everyone was wearing a mask. We came back in October for that 2-day session. Everyone was wearing a mask. So I think we're going to be okay.
So will you be doing some testing before the session begins and testing throughout the session?
I think that there will be some testing. I understand there may be some testing before the session, but we will do what we've done before, the temperature checks. I think that is the plan so far. It may be something more extensive, but I hadn't been made aware of any.
What do you think lawmakers need to do to improve the state's response to the pandemic?
What do they need to do?
Yes. We have been relying on the governor to take a hard line in the sense that make a hard decision about what to do about statewide mandate on masks and those kind of things. If he doesn't, one of the things we're going to talk about, and I would hope we would, is to see if we can pass a statute that will require people to wear a mask, at least until there has been a thorough vetting of the vaccine and use of the vaccine, and just whatever it takes to not only protect our citizens, but to protect their coming and goings and their ability to just lead a normal life. I mean, nobody wants schools to be closed. Nobody wants businesses to be closed. But we also don't want people to get sick. If you got to make a choice between one of the two, we want people to be well. But you can do both if you put protocols in place, and they have to be enforced. And I don't think it takes that much enforcement if everybody in leadership, from the governor on down, we're all on the same page saying this is what you must do.
Dr. Birx kind of called out some of the Sun Belt governors about how the handling of the pandemic. Do you think that was fair?
I think it was fair. There's a time to be political. There are instances where, it can be understood why people take political positions or they do the politically expedient thing. But when it comes to life or death decisions, I don't think that this is a time for people to act that way. When the governor says, and I regret that he said it, but when he says, I get tired of these so-called experts telling me what to do, I don't know what other experts you can rely on but the top health officers. And these are doctors. Their only agenda is treating people and saving people's lives. And if they recommend that you do something, I would suggest that's what we should do. So in this instance, I think that would have been a prudent thing to do. And this has been consistent across the states, the Sun Belt states, the southern states. This has been consistent. Doctors, medical professionals have said, this is what you should do. And we've had political leaders, not listen. Even the president took that position at some point. And these are not so-called experts. These are actual experts. These are frontline people who are dealing with this crisis hands-on every day. So we should listen to them.
Do we need to have a statewide mask mandate?
Yes, we do. We need to have a statewide mask mandate. And I don't say that because of what Robert Johnson thinks. I say it because every medical professional that I've talked to says that's what we need to do. Every medical leader, every scientist that I know has said that's what we need to do. And when the governor instituted and asked for a statewide mandate, our numbers went down. I don't know what other proof you need. And we should do that as long as the medical professionals say we need to do it. Somebody asked me the other day, so how long do you think we need to do it? I don't know. But Dr. Dobbs knows, Dr. Woodard knows, Dr. Brunson knows. These doctors know. And when they say we need to do it for a certain period of time, we need to listen.
Let's talk more about the legislative priorities coming up in this session. What do lawmakers need to do on the education front this session?
Well, we need to continue to work on distance learning, and that will include whatever we put in place to deal with the fact that people don't have access or broadband is not available to everybody. We need to step up that effort because it looks like students will be doing virtual learning at least for another semester. And so to the extent that that's true, we need to work on the infrastructure in terms of what we need to do for broadband and make that available to all families, all students. The other issue is whether or not we need year-round school. And to the extent that people are not getting the requisite amount of time in the 9 months that they're in school or whatever the 2 semesters, then we need to put an infrastructure in place to assure that we are teaching our kids, that they are getting the learning or the teaching that they need to move to the next level. And if that means year round, we need to do that. But those are considerations that we're looking at, and they're being explored. But we have to be open, and we have to continue to think and work together about what these solutions are. Well, I know that we've been discussing budget cuts, that the economy is down, but if nothing else, but we need to make those assurances on paper, and with if nothing else, with the promise that when funds are available, we should continue to renew and elevate our commitment to teacher pay raises. I mean, if we ever needed teachers to be more invested, to be more committed to this effort, this is a time. This is not when you abandon that idea. This is when you increase the attention to that idea. One of the things we worked on was the health disparity in poor and underserved communities. And we were going to do that because we have federally qualified health centers all over the state. And they were going to run an accelerated program to address issues in certain areas where people are not getting the treatment that they need. And that is due to our low patient per capita, patient doctor ratio. that we have in this state, the fact that we haven't expanded Medicaid to the extent that there are working people who are working every day in minimum wage jobs, and a lot of them are frontline workers who don't have health care. And so their only avenue for treatment sometimes are these federally qualified health centers or emergency rooms at their rural hospitals. Both of those entities need our accelerated support, need more support. Hospitals are closing. We need to make sure that happens. Health centers where there are no hospitals, at least there's a place that people can go and see a doctor or a nurse practitioner. We need to ramp those efforts up. But the easiest way to make sure that we have the resources in place to fix those infrastructures, the easiest way to do that is to expand Medicaid. There's federal money, billions of dollars sitting there waiting on us to put in place the things that we need to do to provide health care to all of these people. And we keep saying no. Another political decision, one that makes no sense when you're talking about hardworking people in the state of Mississippi.
Thanks, Representative Robert Johnson. We'll be right back. While many communities are working to control the spread of COVID-19, the city of Vicksburg is taking extra steps to enforce regulations. Mayor George Flaggs just issued a new executive order that holds businesses accountable. Mayor Flaggs joins us now via Zoom. Mayor, take us through the order. What are the requirements on businesses?
Well, first of all, let me just say this. This is a supplement of the original order that I brought on last Saturday at 12 o'clock. And that's because our numbers start rising in double digits. And rather than react, I became more proactive. And what I did is simply say, look, you got to wear your mask inside or outside of imminent public places. And where there's a gathering of more than 20 people, including household, then you should wear your mask if you cannot practice social distance of 6 feet, in which CDC guidelines, Dr. Dobbs and Dr. Fauci, everybody says that the mask mandate is working. So why not? And why not put it on the inside and the outside? And if you're walking up and down the street and you with a relative, no, you don't have to have a mask. But if you're talking to a stranger and you're not in the same family, yeah, we're requiring you to wear a mask within 6 feet of a person. I'm trying to save lives, Byron. I'm not trying to make it hard on nobody. I just want to save lives and mitigate the spread of this virus and keep you here for Thanksgiving, Christmas, and possibly for Easter.
And Mayor, what's been the response to the new order so far?
About 95% people are compliant. It's been no problem.
Are there questions?
I have a compliance officer, and she goes out and she educates the public on it. If we get a complaint, we go out and talk to them, and most of yes.
Part of the order is for people who don't comply that you would cut off their utilities. Are there questions about whether you actually have the authority to cut off utilities?
Absolutely. We provide service for them. So you get a ticket if you run a stop sign.
So you could cut them off if they don't comply?
Right. Absolutely.
Well, how has COVID...
Energy can cut your power off if you don't abide by the regulation. When you sign in on for sewage, water, and gas, you said you're going to abide by the city ordinance.
Well, how has COVID...
And this is not to be...
Go ahead.
This is not to be punitive. This is to save lives and to mitigate the spread of this disease. And I'm tired of just always shutting down our government, shutting down our business, shutting down our economy. And why should we do that when it's one or two people not doing what they're supposed to do? But as of the day I report to you, Byron, everybody's doing what they're supposed to do. It's going well.
So you haven't had to cut anybody's utilities off at this point?
Absolutely. On and wrote one citation.
Well, how has COVID-19 impacted your community since you put the mask mandate where there wasn't one before?
Well, what it does is make people, it limits the exposure of people with the virus and being able to spread the virus. We're in a flu season. We're in a coughing season, a cold season. And this is the best time to wear them if you're ever going to wear them. It's now because you don't have to spread the disease. Because we're afraid of the disease, that this virus could be airborne. We're afraid that this disease could be caught by transmission and is asymptomatic, where people that don't have, that may not even have symptoms can have it and not know it. So what we're doing is protecting lives in Vicksburg.
We'll continue our interview with Mayor George Flaggs after this. How are businesses doing in Vicksburg from a financial standpoint right now?
They're doing great. I just looked at, I'm glad you asked that, because we just looked at our revenues for last month. This is the first month of the fiscal year for 2021 in that budget year, and all but gaining. We're up. Gaining is not bad. It's down 18,000 compared to last year. You know why? Because people are staying at home, staying in Vicksburg, they're shopping in Vicksburg. They're going into restaurants in Vicksburg. We're wide open.
Well, COVID-19 cases are surging right now, and Dr. Burks kind of called out Sunbelt states. What actions do you think the governor should be taking now?
Well, I think the governor is going to make some announcement on Friday, I'm told. His order expired on Friday, so he may be making it in the next couple of days. And I'm going to not try to prejudge the governor. I'm going to let him do what he do. I'm Mayor of Vicksburg, not the governor. And I tell people that I'm responsible for Vicksburg, and I take my responsibility serious. I believe in a proactive. I'm ahead of the curve. We're doing what we need to do to keep our economy open, and at the same time, keep our people safe. I got 417 employees, and only 4 employees are out because of the exposure of the virus.
Do you believe we need a statewide mandate?
Oh, absolutely, I believe in it, but that's the governor's call.
How active are you in the vaccine distribution efforts, and how will people in your area get the vaccine once it's approved?
Nobody's mentioned anything to me about the vaccine and the distribution.
Will you take it when this becomes available?
Do I have to?
I don't know if you'll have to, but will you take it if it's available?
I have never taken a flu shot.
Mm-hmm.
And if I don't have to, I'm not going to take it. I hadn't had any symptoms. And if I become ill, I may think about it. And if I need to do it to show people that I'm not afraid to do it, I do it. But I don't want to do it just to do it, because I'm fine. Mm-hmm. I work out every morning. I tell you what I do every morning. I drink hot water with lemon in it, and I take a vitamin C. I've been doing it since March the 4th, and I hadn't missed a beat.
And that's your solution to dealing with the issues?
Yes, I drink hot water with lemon juice in it, with a little baking soda in it, and I take it every morning before I leave home after I say my prayer, and I go to the gym every morning, and I think I'm healthy.
Well, which frontline workers in long-term care facilities will get the initial doses? Have you guys decided that yet?
Do I not get it hit up?
Which frontline workers in long-term care facilities will get the initial doses of the vaccine in your area? Have you made those decisions yet?
No, because nobody's talked to me about how. All I saw is Dr. Dobbs said next week or the next week or two, the vaccine will be in Mississippi. Nobody from the health department, nobody from the governor's office, nobody has contacted me and say the vaccine will be in your area. How should you distribute it? And when they do that, we have a plan. We probably will go to the hospital, go to the healthcare workers and long-term healthcare facilities, and my firemen, paramedics.
Should schools be open? Should kids be in school full time, or should they do some virtual learning right now?
I'm gonna leave that up to the parents, but I have no problem if I had children to send them to school. I talk to my school official all the time. I think they're using all the protocol. They're taking temperature checks. They are monitoring it as close as they can. I think they're doing well. Now, do we have cases? Yes. Are some people in quarantine? Yes. But I think this school district, in my humble opinion, is doing everything they can to make certain that they minimize the spread of the virus.
And should kids continue to be allowed to play sports?
Absolutely. I think that if you use all the protocol, I just left for New Orleans this weekend. My grandson played with Tulane. They did temperature checks. We had to keep a mask on all the time, and we had to set 6 feet apart, and it went well. And by the way, they beat Memphis.
All right, Mayor George Flaggs, always a pleasure talking to you. Thank you for joining us.
I thank you, and let's just stay safe, and let's just listen to the expert and go by what the experts say, and I think we'll be okay. If the politicians just stay out of it and just do what the experts say, I think we got it.
All right, Mayor George Flaggs, thank you.
I thank you.
All right, and we'll be right back. Thanks to Representative Robert Johnson and Mayor George Flaggs for joining us. We'll join you again next weekend for another edition of Mississippi Insight. Until then, make it a good night.